We're here today for the Inflection Point Summit 2026. The Go Red for Women Fund is excited to convene thought leaders across women's health. We're embracing all the challenges of women's health today and coming up with concrete, viable solutions at scale.
So the result of all of this today is really going to be to bring together the ideas from the study guides to the work in this room today to help create a playbook and a roadmap for people to start to think about health differently. And we're hoping that we can start to elevate that thought process for others through the report.
We finally seem to have reached a point where people understand that women are a very large population of people who have different biological requirements. And we're starting to see companies evolve to a point where they're making a material difference, as well as research evolving to a point where it's making a material difference in the science and the medical knowledge. So we can bring those two things together and make a difference from a company impact at the patient level and at the provider level.
Today we are talking about autoimmune disease. It affects 50 million Americans, and 80% of the patients are female. So let's talk about a disease that disproportionately impacts women.
What I hope is that everyone who attends the summit today is going to learn something that they can put into action wherever they go back, if they go back to a health plan or a health system or an individual clinical practice.
Well, I love with the summit today how AHA is bringing together these various stakeholders, in some cases at different points in their career, and bringing in payers, providers, investors, really to talk about three key problems, and problems that I'm mind-boggled that we haven't solved for yet.
I know we're excited now. Round 2 went really well. I heard lots of great feedback from the first conversation. I think we're changing the world as we speak, which I love.
There's been so much work done around maternity services, and I think we've moved beyond that into thinking about specific disease categories that disproportionately impact women. And I think there's a real opportunity to really tease out the data, the research, the moment to say, where is there a there on these diseases?
The more eyes on the problem, the better. And the different perspectives, the more you get those pressure points relieved at each step of the patient journey.
And that's what's exciting about the event today, just the folks that have been brought together who represent those various stakeholders. And so I think there's going to be a rich discussion about that, and getting the perspectives from all those stakeholders is ultimately what's going to allow us to figure out what the solution is.
We need to make a difference on all these fronts. You can't win the war in one battle. You got to fight all the battles. And we're hoping to find solutions and catalyze solutions today at this event that help us make a difference in all these categories.
And we have seen a lot of monetization of anxiety and desperation. And so how do we take that phenomenon and channel it back into a more evidence-based approach?
There's a lot of direct-to-consumer opportunities and a lot of cash pay opportunities. We often forget about Medicaid women and other underserved women. And the only way that we're going to be able to bring together training and practice and financial incentive alignment is by having everyone at the table and everyone benefits.
And so for me, I came here to step back to help think about what is our North Star? What problems should we be focusing on? What people should we be including in the solutions? And then we can get back to the day-to-day to try to solve it. So it's kind of thinking about what's the broader strategy so that we can come up with the tactics to get our job done.
I would like to see the burden lifted from women, from having to take each symptom that they may experience and sleuth out where to go, who to speak to relieve them of the burden of saying, this is not just one symptom or one disease, this is many, and I know there's something else going on with me.
I've learned a lot. This is a very different forum, and something that I think is really helpful because you've basically taken the ecosystem of healthcare and put it in this room.